Hello, I am Dr. Sairam, prosthodontist and implantologist in AP Superspeciality Dental Hospital. Today I am going to give a short video regarding tooth loss and its impact on oral health and general health of an individual. So this tooth loss will remain a significant deterrent in the oral cavity, and this tooth loss accounts for an irreversible damage in the oral cavity. This tooth loss is divided into two types. One is complete edentulosum, wherein all the 32 teeth are lost in an individual's mouth. Second one is partial edentulosum, wherein only few teeth are lost and the remaining teeth are still intact inside the patient's mouth. According to a survey, nearly 35% of an Indian population is having this tooth loss issue, and females are more prone to partial edentulosum, wherein males have a higher incidence of complete edentulosum according to this survey. Is the tooth loss having an impact on the general health or oral health of an individual? Yes, absolutely. Now coming to the impact of tooth loss on oral health of a patient. When a patient loses his teeth, what will happen is his facial appearance will get changed, and he has an issue with the phonetics regarding his speech. Mainly, patient will suffer from inadequate dietary supplements. Like if the patient is not having proper number of teeth and good amount of teeth, what will happen is he cannot chew good amount of food like fruits, all the mineral containing foods, and all the keratin antioxidant containing foods. So the patient slowly shifts his diet from a hard food to a soft food, wherein the patient is losing so much of minerals, vitamins that are essential for his general health. So this leads to loss of his systemic health and loss of his physical quality of life pertaining to the loss of teeth. And third thing is, patient will develop something called as oral dyskinesia, wherein patient will move his lower jaw inappropriately and non-purposefully. So purposeless movement of his lower jaw leads to this oral dyskinesia. And fourth one is, patient will also have loss in his facial appearance, and his lower jaw will be pulled outward with prominent chin. So all these will accompany for a psychological trauma for the patient. As we have discussed earlier, the patient is not taking good amount of healthy food, which means he is compromising on his general health too, apart from the oral health. And as the patient's physical quality of life is imbalanced because he is not taking proper amount of food, more amount of cholesterol will get deposited and he has a higher risk of going to cardiovascular diseases. Apart from this, loss of teeth will also leads to certain ulcers in the oral cavity called aphthous ulcers. And apart from the aphthous ulcers, patient will also develop gastrointestinal ulcers because he is not taking proper amount of vitamins and minerals that are required in his regular diet. All these compiled to the complications or impact of tooth loss regarding our oral health on the oral health and the general health of a patient. If a patient is having partial tooth loss, that means partial edentulosum. Now, what happens is, he'll chew more onto the side wherein the teeth are present in good number and good quantity. That in future leads to tooth wear and tooth abrasions, and simultaneously patient will develop tooth sensitivity too. Apart from that, the edentulous side wherein the patient is having loss of teeth on that side of the mouth, the adjacent teeth will move or drift into that edentulous space, and sometimes the opposing arch teeth will also come down to occupy the edentulous area. This ultimately leads to very difficult in rehabilitating such kinds of patients, and the patient is also remained with less amount of teeth, wherein he is not able to chew on the side of teeth where the teeth are absent. So let us consider the impact of teeth on the oral health and the general health. Switch to an appointment regarding the rehabilitation for the loss of teeth to AP Superspeciality Dental Hospital. Keep smiling. Thank you.